Transforming Community Services is a programme where we look to review those services provided in the community. We're looking to redesign and re-specify those services to provide them in a way that will be fit for the next few years and also for future generations.
We have a considerable proportion of elderly patients who often have very complex healthcare needs.
And that means that we are facing the challenges of an ageing community several years earlier than the rest of the country. This means that we've got to probably act more quickly than everywhere else in making the services fit for purpose.
We've done lots of engagement events, including health summits.
And we've heard from carers, we've heard from the voluntary sector.
We've had long-term conditions events.
We've heard from the community hospitals and representatives of the community hospitals about what they value. And people have a real willingness to do things differently.
There are too many barriers to providing good care. Part of this is the lack of integration between healthcare and social care, and one of the aims of this strategy is to make a much bigger integration between the two.
So through our engagement with members of the public in our communities, we've been told by these individuals that there are 6 key priorities that they would like us to work towards when commissioning or buying healthcare services for them as we move forward.
The first of which is helping people to stay well.
To have services that keep people healthy and prevent diseases happening in the first place.
Integrated care, joining up health and social care.
Personalising healthcare provision.
You have a very much bigger say in what you want and even control of some of the budgets.
Coordinate pathways of care.
Patients want pathways that are built around them and are coordinated and streamlined.
Thinking about carers.
We want to support carers and make sure that they remain fit and healthy and can continue the vital work that they do.
Home is the first choice.
There's no bed like your own bed where it is safe and practical to have that care.
So the priorities that you've given us as patients underpin our strategic framework which we're publishing at the moment.
One of the key things that's going to come out of our TCS strategy is the development of pathways for adults with complex needs with regard to prevention in episodes of crisis and also rehabilitation. It'll also include end-of-life care when that's appropriate. What we hope to do by developing these pathways is really to integrate health and social care.
There are a number of specialities who provide care in the community, such as the bladder and bowel team. We want those services to be the best possible for our population. And that means we're going to have a look at these services and how we provide them and see what we can do better.
So the CCG is really going to try and focus on prevention of illness and also personalisation of care. So what this means is patients will in the future be able to help design how their care is delivered on a person-by-person basis.
We want to look at urgent care in the community. In our document, we will lay out a vision for a consistent quality service. Where possible, we want people to be seen and treated in one visit.
By strengthening community services, we will keep people healthy and reduce costs elsewhere in the system.
One of the things we've been talking to communities about is changing from a bed-based model in community hospitals to developing the buildings into health and wellbeing hubs, which can serve both health and social care needs.
So there have been numerous technological advances in recent years in medicine. I think now is an absolute ideal opportunity to try and understand and to allow patients to benefit from how technology can be used in patients' homes. Technology is there, ready to go. We just need to make sure that it suits people and it's being provided in an accessible way.